Hi, my name is Tenzin Chime. I am doing my nursing issues and trend facing healthcare on working long hours in nursing and how it affects both nurses and patients. So, what is long hours in nursing? Working 12 to 13 hours or longer per day. There are times when we nurses have to work 16 to 18 hours due to lack of nurses on a given shift. Also working 12 to 13 hours or more in many days in a row. There are times when nurses pick up extra shifts because of the shortage and high census, depending on which unit you're working at. Also, nurses have to come in for the meetings. That takes away the time from their personal life. So some of the effects working long hours of nurses have on the patients are medication errors, poor patient safety, lack of critical thinking skills, surgical errors, and it can also cause patient mortality due to all these errors. Benefits of working long hours have on the patients are consistent with care. That helps with developing trust between the patient and the nurses. Also helps nurses have a better knowledge of their patient by taking care of them for like 12 hours, so we know how they were in the beginning of the shift and how they were when you were going home. Um, Also, it decreases the number of handoff that we have to do between the nurses, which also help reduce sentinel events. Um, Examples like having a wrong site for the surgery, medication errors, also delay in care, sometimes due to miscommunication between the handoff or information being left out during handoff. We delay the care in the patients, getting images done. Sometimes we forget to pass that information on, so that delays the care in the patient. Some of the effects that it has on nurses for working long hours are sleep deprivation, deterioration of caring for self and the patient, also decline in neurocognitive performance that affects our critical thinking skills, can also cause fatigue-related injury at work and outside of the work as well. Sometimes we're just too tired to go drive home safely, leading to accidents and such. Also causes mood disturbance, which can also affect care for the patient and your personal life. Or can also cause GI issues with the stress and lack of proper nutrition. Can cause GI issues as well. It also increases the risk for coronary artery disease by 40% in nurses. Can cause depression and anxiety, high blood pressure and diabetes, leading to cardiovascular injuries. Also can cause musculoskeletal disorder because having to stand on your feet for long hours can cause that. Also leading to burnout and job dissatisfaction in many nurses. So working long hours and many days can lead to burnout, and burnout has a huge impact on both nurses and patients. These are some of the signs and symptoms. I want to read out some of that have mental fatigue from CE classes, ulcers from holding back urge to punch somebody out, varicose veins from standing on the feet for long hours, just poor vision, bad posture from standing or sitting, breaking your back. All of these impact symptoms. So on a serious note, burnout can reduce the nurse's energy, impacting both nurses and the patient. It can cause emotional exhaustion. Sometimes you just like don't care anymore because you've been doing it for too long. Also lack of motivation, feelings of frustration. It recently happened to me when I was taking care of this long-term patient who wasn't able to sleep. So we are trying multiple medications, but due to his blood pressure and other symptoms and diagnosis, we were limited, and that leads to frustration on the patient and the nurses and the team that's taking care of the patient. Also, burnout can also lead to reduction in work efficiency, poor judgment calls, like in the work area and in their private life as well, leading to changing careers and general dissatisfaction with self or work. Burnout that can impact on the patient is inadequate standards of patient care. We just don't do our best. We're just too tired sometimes. Poor patient engagement, leading to distrust between the patient and the nurse. It is costly for organization, as in when the nurses get burned out, they change their careers or move to a different hospital, leading for organization to hire new nurses, spend money on the trainings and educations and all that. And also has negative impact on other staff. So if somebody is burned out, frustrated, tired at work all the time, it impacts the whole environment of the unit as well. Knowing all this, why do nurses work long hours? There are many reasons. One of the reasons that most nurses would say is more days off in the week. Also, due to shortage of staff, nurses having to pick up overtime due to shortage of staff. Also, the financial need will make nurses pick up extra shifts. Has a sense of responsibility. Like you come in on your shift and you realize there's shortage of nurses the next day, but you have the day off, but you kind of feel the sense of responsibility to help out your fellow nurses. So you come in for an extra shift thinking it's not a big deal, but you keep doing that and that will lead to burnout. Also, sometimes you want continuity of care. You want to take care of your patient the next day, and if they're short, you volunteer. So making a deal saying that if I get my patients back, I'll take care of that. I'll pick up their extra shifts. And if you do that multiple times, and that can lead to burnout. So can you fix this? There are studies done. California has recently had a policy of banning nurses mandatory overtime, making it so the nurses can only pick up limited amount of overtime. That's mandatory. And also limiting voluntary overtime. It hasn't been passed out anywhere, but studies are saying that limiting the voluntary overtime can help decrease the number of burnout in nurses. Consecutive work hour law, so making law stating that you cannot work more than 48 hours or have working hour per week should be less than 60 hours. No matter, you can work 8 hours, 10 hours, but limiting the number of hours. Also encouraging within the facility to have a work-life balance and encourage the nurses to take their days off and not guilt them into picking up extra shifts. Also providing resources for self-care and mental health. Some of the facilities what they have done is providing better meals on the cafeteria, healthier meals for the nurses, and also providing healthier snacks. I've seen one of the unit provides their own snack for nurses. They would pick healthy snacks for $1 and you pick whatever you want. Also like sandwiches, healthy sandwiches to help with the self-care. So these are a few things. We still have a long way to go about these burnouts and working long hours. It is difficult due to some nurses wanting to work overtime or having to work overtime due to financial need or other needs they have. So it's still an ongoing issue, and I think it will be long before we can fix it completely. These are my references.